I'm Dr. Streicher. Your question is vaginal estrogen safe for women with breast cancer? I'm going to give you the inside information. For the woman who's newly contending with the diagnosis of breast cancer and dealing with the overwhelming stress of surgery, chemotherapy, maybe radiation, sex is usually the last thing on her mind. The emphasis is and should be on treating the cancer. But even after a woman has finished treatment, the consequences on a woman's sexuality are often minimized. It's not unusual for a breast cancer survivor to attempt intercourse only to find out that what was once satisfying and enjoyable is excruciatingly painful or impossible. And sadly, too many women feel reluctant to complain about the loss of their sex life. And if she is brave enough to bring it up to her doctor, it's typical to not get a lot of advice beyond buy lubricant. And when that doesn't work, most women give up, assuming that vaginal estrogen, the most successful way to reverse vaginal dryness and intercourse, is just not an option. Even if the doctor does give the go-ahead and write a prescription, many women take one look at the package insert that practically has a skull and crossbones on it and decide it just isn't worth the risk. So I'm going to start with the headline. There is no evidence, none, that using a teeny amount of estrogen directly on vaginal tissues causes an increased risk of breast cancer recurrence. In fact, we have a lot of reassuring data that proves the exact opposite. Now, one study of 1,472 breast cancer patients who routinely use vaginal estrogen determined that women with breast cancer that used a local vaginal estrogen actually had a lower recurrence rate than women who did not use vaginal estrogen. And that's because the minuscule amount of estrogen absorbed from the vaginal use of estrogen doesn't even increase blood levels above the normal menopausal range. Another large study was published in 2018 that was even more reassuring. Not only was there no increase in cancer, but there was also no increase in cardiovascular disease or any other negative health outcome. It's really unfortunate that the FDA refuses to remove the scary, inappropriate black box warnings, despite efforts to do so from every leading medical society. In 2016, the American College of Obstetricians and Gynecologists, known as ACOG, released a statement very clearly stating that the use of estrogen in women with breast cancer is safe and appropriate. ACOG stated, data do not show an increased risk of cancer recurrence among women currently undergoing treatment for breast cancer or those with a personal history of breast cancer who use vaginal estrogen to relieve urogenital symptoms. I published a study in 2013 in the Journal of Sexual Medicine showing that a majority of gynecologists, female gynecologists, would themselves use vaginal estrogen even if they had breast cancer. And it's not that gynecologists are more willing than the general population to risk their lives in the name of having good sex. It's that gynecologists know that the black box warning that lists the dangers of using estrogen is not based on data that has anything to do with vaginal estrogen, much less women in breast cancer who use vaginal estrogen. And most breast surgeons and oncologists who are really conservative are now comfortable allowing women with breast cancer to use a local vaginal estrogen. Now, ultimately, you need to do what you're comfortable with. But if you do decide to use a vaginal estrogen, it should ease your anxiety a lot, knowing that scientific studies, most gynecologists, and also ACOG are firmly on board. But you will find lots more information on alternatives to estrogen in my book, Sex RX, Hormones, Health, and Your Best Sex Ever, and my other videos, which you can find on YouTube and drstreicher.com.